The important role of genetic screening. All expectant parents want what's best for their babies. As you prepare to grow your family, it's important to know that there are screening tests available that can help you understand the potential for any issues so that you can make the best decisions for you and your baby. Family history can reveal a lot about a woman's health and the health of her baby, but many people are carriers of inherited conditions and simply don't know it. In fact, over 80% of children with inherited conditions are born to parents with no known family history. To identify these inherited conditions, carrier screening can be done during pregnancy, although getting it done before getting pregnant can maximize your options. Carrier screening looks for changes in the genes of the mother and father called mutations. These mutations can be passed down to a child. In most cases, for a child to be at risk of developing symptoms of a condition, both mother and father need to be carriers for the same condition. This is called recessive inheritance. Being a carrier for a condition means the parent has one normal and one mutated copy of the associated gene. As long as a person has one normal copy, they typically don't have any symptoms. If both parents are carriers for a condition, there is a 1 in 4 chance for every pregnancy that the baby will inherit a normal copy of the gene from each parent and will be neither a carrier nor affected. There is a 2 in 4 chance for every pregnancy that the baby will inherit a mutated gene from one parent and a normal gene from the other. This would make the baby a carrier, like both parents. And like the parents, the baby would not have symptoms. Finally, there's a 1 in 4 chance with each pregnancy that the baby will inherit 2 mutated copies of the gene and develop symptoms associated with the condition. There are a few conditions with a different type of inheritance, called X-linked recessive inheritance. Sex is determined by the X and Y chromosomes. Females have 2 X chromosomes, while males have 1 X and 1 Y chromosome. When the gene associated with a condition is on the X chromosome, each male child has a 1 in 2 chance of being affected. What happens after carrier screening? If the mother tests negative, no further testing is needed. However, there is a good chance the mother will test positive. More than half of people do. If the mother's results show she is a carrier for a recessively inherited condition, the father should undergo carrier screening. If both parents are found to be carriers for the same recessive condition and a pregnancy is already underway, you can pursue diagnostic testing, such as chorionic villus sampling or amniocentesis, to definitively determine if the baby is expected to have symptoms. Remember, even if both partners are carriers, many pregnancies are perfectly healthy. Whether or not you choose to have a diagnostic test, there are many steps you can take to plan and prepare for the birth of your baby. This may include discussing options with your provider, speaking with a specialist, seeking out a facility equipped to manage newborns with genetic conditions to deliver in, or simply talking with a genetic counselor or working with a support group to understand what lies ahead as you prepare for delivery. If carrier screening is done before pregnancy and both parents are found to be carriers for a recessive condition, you may want to consider alternative family building options like in vitro fertilization, also called IVF, where embryos are screened for genetic disease before implantation, adoption, or sperm or egg donation. For more information, speak with your provider